Hi, good evening. So today we are going to start a topic that is a connective tissue. So before learning about a connective tissue, I want to give a definition for the tissues. Tissue means a group of cells which are similar or dissimilar will perform a common function. So that is called as a tissue. So now this tissue is includes in the animals, and in the animals there are four types of in that. This is the one type that is a connective tissue. And the name itself indicates that connective means it connects the two different places or two different organs of a body. That is called as a connective tissue. So this connective tissue even connects like epithelium tissue next and also other tissues with the right. And it basically focus on the binding of the organs. Sometimes it may helps in the supporting like our body framework, and sometimes it may helps in the packing like a adipose tissue. So this is the way how they are done. So there is some classification in the connective tissue. So these connective tissues are classified into three types. Type 1, it is we can call it as a that is fluid connective tissue. So why we are calling? So before that, suppose on the screen we can see a cube type tissues you are seeing. So if you see that the what like there are red color cells, white color cells, and the platelets. Along with that, some liquid you are able to observe. So the beside between the two cells there is a liquid is present. That liquid is called as matrix. The fluid which is present or substance which is present in between the cells or intercellular spaces should be called as matrix. The matrix form here, it is the fluid form or liquid form. Okay, liquid form. So we are calling it as a fluid connective tissue. So going to the second tissue, see here, the matrix is jelly-like form, right? Matrix is jelly-like form, and their cells are arranged in between the different types of tissue. So this is called as a loose. What is that? Gel. That is proper connective tissue. Proper jelly-like connective tissue, proper connective tissue. Next, we are having a solid connective tissue, which is there it can be called as a skeleton connective tissue also. Whereas the matrix in the form of calcium, okay, that will be there. So that is the solid connective tissues. So this is the types of the solid connective tissues. So now we are going to deal with the first one, loose connective tissues. What are the loose connective tissues we are having? One is the first one, it is loose connective and the dense connective, which two comes under what is that? Proper connective tissues. Here I will write. So here proper connective tissue is of two types, loose and second one is the dense, loose and dense. So that is called as a two types. So in that now this under loose will come areolar. Second one is the adipose. Adipose is simple. Everyone knows this very easy tissue where all the cells are each cell is called as adipocyte. Adipocyte. So adipocyte cell. So here this cell will be there. So this is the adipocyte cell. Means a fat cells. Group of fat cells become as a fat tissue in the body. So these are the adipose cells. Okay. So we got a like structural information. Nucleus is periphery and the fat will be deposited and spherical, that is. Now where they are present below the skin and below the kidney, below the heart, different places. And what is the one role of this tissue will? It helps as a thermal insulator. It acts as an insulator and a fat reservoir of the body. Next one, areolar connective tissue. Areolar connective tissue, we are having a that is areolar, that is we are having mast cells, macrophages, that is plasma cells, and fibroblast cells. These are the different types of cells will help in us which helps in which are present to connect the skin with the muscles or muscles with the neurons and different places of the body. This is the areolar connective tissue. So this we have. Next one. So we have completed a under proper connective tissue two one we completed, that is loose. Now coming to the dense. Why we are considering as a dense means if number of cells are more, the matrix low count of low, that is the fiber will be number of matrix will be very less, that is fiber will be more and number of cells will be more. So dense connective tissue. So this dense connective tissue two types. The one is the tendons, other it is the ligament. Ligament is a tissue which connects the two bones to bone. bone to bone connection, which connects the that is bone to bone, and whereas the tendon will connect the muscle to bone. So this muscle which connected to the bone is called as a tendon, and a bone to bone connection, this one is called as a ligament. So this is the one we have. So this is about the two tissues, and it is less flexible, and ligament is more flexible. Here we contains a like elastic fibers are less here. Here elastic fibers are more. That is the reason. Next, we completed a under connective tissue. We completed a. We are having three. Then that proper. Second one it is we are having a skeleton. Third one we are having a fluid. So we completed a proper in that dense we completed and loose we completed. Now coming to the skeleton, we are having cartilage and other it is the bone. So cartilage is a tissue where it is made up of a cells are called as chondrocytes. Chondroblast cells are chondrocytes. The properties, if you see, what is the characters means they are slightly harder in nature, flexible in nature, no vascular bundles means sorry, like vascular bundles not vascular tissue is absent here. It means that is blood vessels are absent, and generally we are the present in the pharynx, trachea, and the nasal septum, or tip of the nose, ear pinna, are in between the vertebral column. These are the three types of tissues. Next. So, whereas bone is a tissue which is made up of a cells, osteocytes or osteoblast cells, and it is rigid in nature, that is solid and highly vascular. Matrix is the minimal matrix with a that is ossin. Ossin is a protein that is bone protein content, and along with the calcium and magnesium. And it helps in the framework of the body, shape of the body. It protects the vital organs like brain, heart, and the lungs by different bony cavities. This is about the skeleton connective tissue. Skeleton is of that is cartilage and other it is a bone. Next, last one we are having up to now we completed a that is under connective tissue. We completed what is that? We completed first one is a proper connective tissue. Next one skeleton we completed. Third one we are going into the fluid connective tissue. Why is simple in the name itself it indicates the whatever the cells or tissue is in the form of fluid form. Here the first one we are having a fluid connective tissue two types. One is blood, other it is the lymph. Blood will be having a cells RBC, WBC, platelets, but lymph will have only WBC. Okay, RBCs are called as erythrocytes, and lifespan of RBC is 126, and the platelets lifespan is the 7 to 8 days, and plus that is 2 to 3 cells is the white blood cells. So here RBC is also called as erythrocytes, platelets are called as thrombocytes, and white blood cells are called as leukocytes. So they RBC are concerned main important exchange of gases, that is their platelets are blood clotting, and white blood cells are immune system. So this is about the blood. So matrix is in the form of plasma. If you take 10 ml of blood, in that 5.5 ml of blood is the but plasma, remaining 4.5 is the blood cells. And lymph. There is a colorless fluid in the body. It contains only white blood cells, and it helps in the even it helps as a that is transportation of substances. It is also called as a middleman or a messenger or a middleman of the transportation in between the different body parts and heart. So it is a middleman. The next. So that we are having a about fluid connective tissue. So today we have so one small recap we'll do, and then later we will go with the next topic in the next class. So we started animal tissues. Under animal tissues, we today we have started connective. Under connective, there are of connective is further divided into three types. So first one it is called as a proper skeleton. Third one we are having a third one it is the fluid. Next, here proper we are having a dense, other it is a loose. Whereas skeleton we are having bone, other it is a cartilage. Next fluid we are having blood. Next one is the lymph. So these are the types. So blood contains a RBC, WBC, platelets, and lymph contains only the what WBC. So this is the what today we have completed. I hope you have got idea that. Thank you and please watch these videos. Thank you and we will meet in the next class.